Dear doctors, Dr.MedExedu Indian Medical Society is going to start few MCQs based on the anatomy. I hope you people will enjoy it. Go through this MCQ and you will get a lot of advantage. Okay, let's start first MCQ. A smart person was climbing the staircase of the restaurant in the Valmiki Tiger Reserve, West Champaran, Bihar. There was no light, and suddenly he fell on the ground. An iron nail hit the posterior triangle of the neck. After the injury, the patient had difficulty elevating his shoulders and present with a loss of shrugging, and the structure is most likely to be damaged. I hope you people know the cranial nerve 11. It's also known as accessory nerve. Okay, accessory nerve. The structure most likely to be damaged in this scenario is this accessory nerve, that is cranial nerve 11. The most symptoms described, including the difficulty elevating the shoulder and loss of shoulder shrug, are characteristics of the injury to the accessory nerve. The accessory nerve innervates the trapezius muscle, which is responsible for shoulder elevation and shrugging movement. So, which muscle is responsible? Trapezius. Which one? Trapezius. Which one? Trapezius. Okay, trapezius muscle. Okay, come to the next question. What is the answer? Accessory, that is 11th option B. Option B. Question 2. Which structure is palpated in the given image? Which structure is palpated in the given image? Anterior tibial artery, B is posterior tibial artery, plantar artery, or dorsalis pedis artery. Which one? Yes, of course it's posterior tibial artery. Okay. The structure being palpated in the given image is the posterior tibial artery. Why and what? It would be located in the posterior tibial artery. The posterior tibial artery is palpated behind the medial malleolus. Where? Behind the medial malleolus. Behind the medial malleolus. Behind the medial malleolus. The bony prominence on the inner side of the ankle. Bony prominence on the inner side of the ankle. This is another common site for checking peripheral pulses in the lower limb. Okay. Question 3. Question 3. Identify the arrow mark structure. Identify the arrow mark structure. Yeah, where is the arrow? See, where is the arrow? Identify the arrow mark structure. What is this? This is called capsule, internal capsule, thalamus, lentiform nucleus. That is internal capsule. Okay, internal capsule. The arrow mark structure is internal capsule. The internal capsule is a white matter structure that separates the caudate nucleus and thalamus from the lentiform nucleus. Caudate nucleus, caudate nucleus and thalamus. It separates caudate nucleus and thalamus from the lentiform nucleus. From lentiform nucleus. It is commonly seen as a distinct band in the brain imaging. It is commonly seen as the distinct band in brain imaging. Okay. Yeah. Come to the question 4. The endoscope has reached 25 centimeter from incisor teeth during the endoscopic procedure. Generally, at this specific number mentioned in the question, the endoscope has reached which landmark? Okay. Especially, it's telling in the question that 25 centimeter from where? From incisor teeth. Okay. Especially at 25 centimeter, there is a arc of aorta. Okay. During the endoscopy, when the endoscope has reached the 25 centimeter from the incisor teeth, it has typically reached the level of the arc of aorta. The arc of aorta is approximately 23 to 25 centimeter from the incisor teeth, and this anatomical landmark is often noted during the esophageal endoscopy. Okay. Come to the question number 5. Question number 5. Identify the arrow marked structure. This one. Arrow marked structure. What is it? Arrow marked structure. Linorenal ligament. What is it? This is linorenal ligament. Okay. This is renorenal ligament. Linorenal ligament. Okay. The given arrow mark structure is linorenal ligament. The linorenal ligament, also known as the splenorenal ligament. This is called also SPL. Splenorenal ligament. Okay. Splenorenal ligament. It connects the spleen and left kidney. Connect the spleen and left kidney. Spleen and left kidney. It contains the splenic artery and vein. It contains a splenic artery and vein. It contains a splenic artery and vein. Come to the question number 6. A patient has come to the clinic, your clinic, you are sitting in the hospital. What is being examined in this image? Just they are asking what is the process, what is the examination of the name of the examination. Okay. So the name of examination of this person is abduction. What is it? Abduction. That is D. Abduction. Okay. Abduction. In this image, the abduction is checked by examiner. The superior gluteal nerve, especially what they are taking, superior gluteal nerve. The gluteus medius and the gluteus minimus paralyzed, which are hip abductor. Pelvis sags falls to the opposite side. Trendelenburg sign is positive. Lurching gait, if unilateral, waddling gait, bilateral. Come to the question number 7. Question number 7. Question number 7. Which structure developed from the 6th pharyngeal arch of the artery on the left side? Okay, artery on the left side. Artery on the left side. What is the answer? Answer is arc of aorta, ductus arteriosus, common carotid artery, and subclavian A. What is the answer? Ductus arteriosus. The structure that develops from the 6th pharyngeal artery on the left side is ductus arteriosus. The ductus arteriosus is a fetal blood vessels that connects the pulmonary artery to the descending aorta, allowing blood to bypass the non-functioning fetal lung. After birth, it typically closes and becomes the ligamentum arteriosum. Come to the question number 8. Okay, come to the question number 8. A nerve was injured by a surgeon during the emergency surgical procedure of the ear. Due to this, the patient presented with a lack of thalamus after the surgery. Which of the following nerve is most likely to be damaged? Cranial nerve 5, cranial nerve 6, cranial nerve 7, cranial nerve 8. So which one? C. Cranial nerve 7. Cranial answer is cranial nerve 7. Okay. Cranial nerve 7, the nerve most likely to be damaged resulting lack of thalamus, inability to fully close the eye. Lack of thalamus. What is this? This is inability to fully close the eyelids, or we can say eye is partially opened during sleep. Okay. The facial nerve controls the muscle responsible for facial expression, including the orbicularis oculi muscle, which is responsible for closing the eyelids. Eye Which muscle is responsible to close the eyelid? Orbicularis oculi. Orbicularis oculi. Come to the question number 9. What is the joint between the epiphysis and diaphysis of the long bone? Epiphysis and diaphysis of the long bone. Symphysis, synostosis, and synchondrosis, syndesmosis. What is the answer? Answer is synchondrosis. Synchondrosis. Option C. Synchondrosis. Okay, please tell me. Yes, you are also right. Synchondrosis. Please tell me the another one. The few information. The joint between the epiphysis and diaphysis of a long bone during growing is a synchondrosis, which is a cartilaginous joint where the bones are joined by hyaline cartilage. Cartilaginous joint joined by the hyaline cartilage. Come to the question number 10. Come to the question number 10. The lining epithelium of the trachea is. The lining epithelium of the trachea is. Which is the answer? That is C. Pseudo-stratified ciliated columnar epithelium with goblet cells. Okay, with goblet cell or without goblet cell. With goblet cell. There is also none of the above, but the answer is C. Come to the question number 11. Anterior fontanelle closes at what time? Okay. Anterior fontanelle closes at what time? Okay. So the time is anterior fontanelle. Okay. 0 to 3 months, 3 to 6 months, 10 to 12 months, and answer is 12 to 24 months. Okay. Answer is so anterior fontanelle. Okay. Anterior fontanelle typically closes 12 to 24 months, and anterior or pragmatic. Anterior 3 months, that is posterior. This one 3 months is that one is posterior or lambdoid. Posterior lambdoid. And anterolateral sphenoid 6 to 24 months. Okay. Anterolateral sphenoid. 6 to 6 to no 24 24 wait 24 months 24 months 24 months. What is anterior or pragmatic? Anterior or pragmatic. Come to the question number 12. A village carpenter fell down on the outstretched hand, got injured while walking. He presented with pain and swelling at the base of his thumb. Which bone is most likely to be fractured? Which bone most likely to be fractured in? That is scaphoid. That is scaphoid. Question 13. The patient has an infection in the cavernous sinus due to which it has involved the nerve which is related to its medial side. To confirm the involvement of the abduction nerve, you will ask the patient to look towards which side? The abduction nerve, that is the abduction nerve, that is nerve, cranial nerve 6. Abduction nerve innervates the lateral rectus muscle, which is responsible for moving the eyelids laterally to the sides. To confirm the involvement of the abduction nerve, you would ask the patient to look laterally. And answer is D. Look laterally. Answer is D. Question 14. A patient from the small city presented to the hospital after an accident. It was observed that he can flex at the metacarpophalangeal joints and can extend the interphalangeal joints. Which nerve is most likely to be damaged? Okay. Which nerve? That is radial nerve. The radial nerve is responsible for the extending the wrist and fingers as well as providing the sensation to part of the hand. If the patient is able to flex the metacarpophalangeal MCP joints but cannot extend the interphalangeal joints, it suggests that the extensor muscle which are innervated by the radial nerve may be impaired. Yeah, come to the question number 15. The surgical procedure is on the great saphenous vein which runs 2.5 centimeter anterior to the medial malleolus. Which structure should be prevented from the being damaged during the ligature around the vein? Yeah, please tell me what is the answer. A surgical procedure being on the great saphenous vein which runs 2.5 centimeter or 2.5 centimeter. Okay, which one is the saphenous nerve? Okay, the saphenous nerve runs close to the great saphenous vein, particularly around the medial malleolus. During the surgical procedure on the great saphenous vein, care must be taken to avoid the damaging of the saphenous nerve to prevent sensory loss or the neuropathic pain in the leg. Come to the question 16. Okay, come to the question 16. Identify the arrow mark in the segment, this segment. Okay, so please tell me what is the answer of this segment. This segment is segment 8. This segment is segment 8, that is answer D. The arrow on the anterior and posterior part of the right lobe likely to point to the segment 8. Liver is divided into the 8 segments, that is liver is divided to 8 segments, that is 1 to 8. Okay, so this was the last segment. Okay, 8 segment. According to the which classification? COU not. COUI NAUD, phenomenon, okay, phenomenon or classification, not phenomenon, it's classification, okay, connote classification, okay, classification. So, which first segment is caudate lobe. First segment is caudate lobe. Come to here. First segment. This segment, first segment is caudate lobe. Which lobe? Caudate. First segment is caudate lobe. Second and third segment located in the left lobe. Segment 2, second is superior and lateral, while segment 3 is inferior and lateral. Okay. So see, one is this, two, this is third, this is 4A, 4B, 5, 6, 7, 8. So altogether 8. So this is in between this 5 and 8, and these are inside the right hepatic arteries. This is right hepatic vein, this is hepatic portal vein, left hepatic arteries, left hepatic portal vein, left, this is left hepatic vein, middle hepatic vein, aorta, this one is aorta, okay, and this one is IVC, and right hepatic vein, okay. Come to the question number 17. During the surgical procedure of the patent ductus arteriosus, the structure which is in the close relation to it can be damaged. What can this structure be? What can be the left recurrent laryngeal nerve? That is option A. Left recurrent. During the surgical procedure of for the patent ductus arteriosus, the structure which is in close to it can be damaged. Left recurrent laryngeal nerve. Come to the question number 18. This arrow. At the arrow mark area, the nerve located here related to which ganglion are disturbed, which ganglion are disturbed due to the involvement of the nerve located at the arrow mark area. Yeah, please tell me. That is pterygopalatine ganglia. Pterygopalatine ganglia. That is pterygopalatine ganglia. The arrow marked structure is pterygopalatine ganglia involved of the nerves in this area can disturb the function of the pterygopalatine ganglia, which is involved in the parasympathetic innervation. Which involve parasympathetic ganglia. Okay, parasympathetic ganglia. Involvement of the nerves in this area can disturb the pterygopalatine ganglion, which involve in the parasympathetic innervation to the various structure in the head and neck region, including lacrimal glands and nasal mucosa and palatine glands. Okay. Parasympathetic innervation. Parasympathetic innervation. Or pterygopalatine ganglia. Okay. So I will explain you through the help of this picture. It will be more clear to location of the parasympathetic ganglia. This is otic ganglion. This is ciliary ganglion. This is submandibular ganglion, and this one is pterygopalatine ganglion. This is the pterygopalatine ganglion. This was our answer. Okay. Pterygopalatine ganglion. The arrow mark structure is pterygopalatine ganglion. This is pterygopalatine ganglion. Okay. Come to the another question. Question number 19. A fracture has occurred at the arrow mark area. The patient can present with which of the symptoms? This area. Okay. So patient will represent which symptom? The patient will have anosmia. Patient will have anosmia. What is anosmia? The arrow mark area involved in the region of the ethmoid bone. Where it is? Ethmoid bone. Where it is? Ethmoid bone. Or the base of the skull. Or base of the skull. Or the base of the skull near the cribriform plate. Where? Near the most likely symptoms would be anosmia. A fracture in this area can damage the olfactory nerves as they pass through the cribriform plate, leading to a loss of sense of smell. The anosmia, loss of sense of smell. Anosmia, loss of sense of smell. Question number 20. Question number 20. A patient presented with extension of the MCP joints and flexion of the interphalangeal joints. Which of muscle is affected? Interphalangeal joints and the MCP joints. The lumbricals and interosseous muscle are affected. Lumbricals and the interosseous muscles, through their attachment to the dorsal digital expansion, cause flexion of the metacarpophalangeal joint. Flexion of the metacarpophalangeal joint. Okay, and extension of the interphalangeal joints. So answer is interosseous thumb. Yes. Come to the question number 21. A 60-year-old male patient brought to the ER due to the suspected stroke. The patient has difficulty forming words but can make noises and give expression as if they understand the question asked. Which type of aphasia is most likely present in this patient? Which type of aphasia? Please tell me. Okay. The given clinical scenario is suggestive of Broca's aphasia. Okay. Broca's aphasia. That is Wernicke, Broca's and global aphasia, conduction aphasia. Broca's aphasia and Broca's aphasia, motor aphasia or non-fluorescent aphasia areas are in Broca's area 44, 45. Okay, 44, 45 in the prefrontal and premotor facial regions of the cerebral cortex are affected. The affected individual will have difficulty forming verbal written words. This individual verbal written words. Okay. The comprehension aspect of the speech is preserved, but the person cannot repeat or name the words, lacks fluency. This person lacks fluency. This person what will have? Lack fluency. Okay, lack fluency. Come to the question number 22. The image below shown here is cross section of the trachea. Identify the structure marked here. Okay, what is this structure? What is this structure? So this structure is tracheal cartilage. This structure is tracheal cartilage. Okay, tracheal cartilage. Okay, tracheal cartilage. Tracheal cartilage. Option B. Come to the question number 23. The image below here of the femur bone, which of the following muscle attached to the arrow? This arrow. Which of the following muscles is attached to this arrow? Okay. The image shown the posterior surface of the right femur and the structure mark A. This structure mark A is the lesser trochanter where the iliopsoas muscle. Option B, iliopsoas. Okay, muscle. Iliopsoas muscle. is attached. Ellipsoid comprises of psoas major and psoas major, psoas major and psoas minor, major and minor two parts. Come to the question number 24. Okay. What is the embryological origin of the label structure? This one. Which one? First pharyngeal arch. First pharyngeal arch. Option A, first pharyngeal arch. Option B, second pharyngeal arch. Option C, third pharyngeal arch. Option D, fourth pharyngeal arch. So first one is first pharyngeal arch is the answer. Why? Because the bony structure depicted in the image is malleus. Okay. Depicted here is malleus. Okay. This is malleus, which can be identified from the hammer shape. And this is malleus is hammer, like just like a mother. When ma, malleus is ma. If baby is not understanding or not obeying the mother will tell, I will beat you. Means she is trying to put the hammer. Okay, ma hammer, ma hammer. Okay, try to remember it. It derived embryological from the first pharyngeal arch. Where? From the first pharyngeal arch. Okay, this is embryology. First pharyngeal arch. Okay, come to the question 25. Identify the heart chamber marked in the CT. Okay, identify the heart chamber marked in the CT. That is left atrium. This is left atrium. So answer is right atrium, right ventricle, and left ventricle. Left atrium is D. Option D. The structure given is this one. Common carotid artery pulse is assessed at the level of. Common carotid artery assessed at the level of. Common carotid artery pulse is assessed as cricoid cartilage. Cricoid cartilage. Okay. Come to the question 27. What is the type of joint marked by the red arrow in the given image? Red arrow in the given image. See here. Question I put in the above. So what is this? This is a red saddle. Okay, this is saddle. See, saddle. What is the type of joint? Saddle. Come to the question number 30 or 28. Which of the following arteries passes in proximity to the area marked by the arrow in the given image? Okay, given image. What is this image? Here, I think here is a place of pterion. The area marked by the arrow given in the pterion. Yeah, here is the pterion, and the artery passes close proximity to this area is middle meningeal artery. Pterion, middle meningeal artery. Middle meningeal artery. Answer is this one. 29. Identify the tendon. Identify the tendons marked here. Okay. That is flexor carpi radialis. Flexor carpi radialis. This is very only image based question. Yes. Question number 30. Identify the anatomical structure marked in the given place. Okay. Given here. So this is abductor pollicis brevis, extensor pollicis brevis, abductor, and extensor pollicis longus. Extensor pollicis longus in the given image is extensor pollicis longus. As the snuff box is triangularly shaped, it has three borders: a floor, a roof. Ulnar is medial border, tendon of the extensor pollicis longus, and radial lateral border. Tendons of the extensor pollicis brevis and abductor pollicis longus. Proximal border is stelloid process of the radius, and floor is the carpal bones, scaphoid and trapezium, and roof is the skin. The main content of the anatomical snob box, anatomical snuff box, a snuff box, a snuff box is radial artery, a branch of the radial nerve and cephalic vein, a branch of the radial nerve and cephalic vein. Okay, so today we will finish it here. Tomorrow again I will continue the anatomy till 30. We finish till 30. From tomorrow I will continue from 31. I hope you people like this. If you like it, share it with your friends and press the button of like so that I will feel that you people are understanding, and I should work more hard and even harder to prepare the PPT and take the class lecture. Thank you very much. Have a nice time. Bye bye. Take care. Enjoy your time.